Hi everyone, welcome to the Medical Tutor channel again. This is Raghat Halaf, and today we are going to discuss the approach to vaginal infections. And I'm really glad that I'm finally going to finish explaining everything related to this subject because I felt like it took forever. I just want to remind you that if you are interested in my tutoring services or if you are suffering with any medical subject in your college, you can always write to my email attached in my description box down below. So without any further ado, let's get started. When female patients come to your office or to your clinic, they will usually complain from the following complaints. Um, it will usually their complaint will usually fill to be one from this list. It's usually a vaginal discharge. They can complain from vaginal itching or vaginal odor or abnormal vaginal bleeding, dysuria, and dyspareunia. And now we are going to discuss how can you take the history properly and what points should you focus on and what questions should you ask your patient. If you are in an OSCE setting, before taking any information from the patient, you have to introduce yourself to the patient, you have to ask her permission and to explain what you are going to do. It's not just for the OSCE because there's always marks on these things, but it's also sorry for your attitude as a doctor. It helps to show that you are polite and you are professional. So starting with the very first part of the OSCE, I didn't write it here. You have to ask the patient about her age. This is the most important thing in OSCE setting. And then you are going to take her chief complaint, which I said previously that it's going to be usually one of these things. And then we are going to do analysis for these chief complaints. There's general analysis for every complaint or for any complaint, not every complaint. There's a general analysis for any complaint. And to make it easy for you, you can remember this word. It's old CART framework. And every letter stands for something you have to ask about. So if your patient came and tell you, I have vaginal discharge, you have first to do the general analysis for her complaint, starting with the onset. You have to ask her when did it start, and then you have to ask about the duration, which means it's the duration here. What is meant by it is to ask your patient if the symptom is continuous or intermittent during the time period which he developed this symptom. And then you have to ask about the course. Is it getting better or worse or it's unchanged? Then you have to ask about the character. And here you have to do a specific analysis for each complaint mentioned by your patient. So the questions you are going to ask here depends on the complaint itself. If it is discharge, we are going to discuss in a minute what questions you have to ask about discharge. If it's pain, you have to use the Socrate mnemonic to analyze the pain, and so on. Then you have to ask about aggravating and relieving factors, and then you have to ask about severity. And when asking about severity, you can give your patient a scale from 0 to 10 and ask her to give you a number in this range, or you can ask her if the severity of her symptom is mild, moderate, or severe. Mild, the patient can easily ignore it. Moderate, it's affecting her life, but it's not limiting her life. And severe, it's really limiting her life or limiting her function. So remember, you have to do the old card for any chief complaint your patient presents with. We are going now to do a specific analysis for each chief complaint one by one. Starting with the vaginal discharge, you always have to ask about these 5 things, like the color. And sometimes it's really easy, or it's going to make it easy for you if you can give your patient examples. Like when you ask about the color, it's pretty much easy because patient can recognize colors pretty much easy well. Yeah, pretty much easy. She can recognize the color. But when asking about the consistency, you can give her options or things. You can tell her words to make it easy for her. You can ask her, is it thick or thin, or if it's frothy and there's bubbles, and if it's curdy, and you have to explain what do you mean by curdy. Even you have sometimes to show her a picture, so you can help her recognize the pattern. Odor, you can ask her if it's fishy or foul, or it's odorless. Amount, you have to ask her if it's scant or profuse. And here, to help yourself with the patient, you can ask her how many times does she change the daily pad, if she is using a daily pad, or how many times does she change her underwear. If she is changing frequently throughout the day, it means that the amount is profuse. If not, it means the amount is scant. And timing, you have to see the relation of the discharge to the period, if it's related or not. And here I listed a few things that can help you think if your patient said that her discharge is thick and white, you can think about candidiasis. If there is fishy odor, think about bacterial vaginosis. If it's green and frothy, you can think about trichomoniasis. But it's actually, you can't rely on these alone. You have to take a full history, and a very detailed one, and a good structured history, to be able to see the whole picture and decide for yourself. You can't just rely on this. If it's thick and white, it's candidiasis right away. No, you have to take detailed history. If the patient complaint is vaginal itching, you have to ask her about the severity, because sometimes it can be bothering, and it can impact her sleep. It can even prevent her from sleeping, or waking her at night. You have to ask about associated symptoms like discharge, and if she said yes, you have to analyze the discharge, as we said previously in the previous slide. If there is redness, if there is burning sensation, if there was an itching and discharge and all these things, you have to consider vaginal candidiasis. If your patient complaint was vaginal odor, you have to ask her if she can describe the odor for you. If she said it's like fishy smell, you have to ask her if it becomes more prominent after intercourse. If she said yes, this is a very strong indicator for bacterial vaginosis. But also you have to ask about associated symptoms like discharge, pain, pruritus, and etc. Abnormal bleeding as a chief complaint, it actually needs detailed videos and separated videos, because this is a whole isolated entity, or a whole different entity. But in the context of vaginal infections, you have to ask about these two things. The very first thing is postcoital bleeding, if it presents or not, if it's presented or not, and intermenstrual bleeding. If she said yes, then you have to raise your concern for chlamydia and gonorrhea, because this means that the cervix is friable and it bleeds easily. Painful urination, which is dysuria in the medical term, you have to ask your patient if it's external, like she feels the painful urination or the painful sensation when the urine is out of her urinary tract, or if it's internal, she feels the painful urination or the burning sensation when the urine is running through the urinary system itself. You have to ask about associated symptoms like frequency and urgency. And here, asking about these details helps you to differentiate the origin of the symptom. Is it from vaginal infection, or is it due to UTI? If sorry. If the pain is internal and there is frequency and urgency, the symptoms are due to UTI, like mostly. If it's external sensation and there is no urinary symptoms like frequency and urgency, it's usually due to vaginitis. So you have to make sure, because if you attributed the patient symptoms to UTI and you treated UTI, and the actual problem was a vaginal infection, the patient symptoms are not going to resolve, because you didn't treat the underlying cause. So it's going to be the symptoms will recur again until you find the actual cause and you treat it. So you have to pay attention. Pain during intercourse, which is dyspareunia in the medical term, you have to ask your patient if it's superficial or deep, or if it's new or chronic. If it's deep and chronic, this suggests that there is an STD or STI, and it can also be it can also indicate toward pelvic inflammatory disease. If there was especially if there was a fever or a pelvic pain or a lower abdominal pain associated with this dyspareunia feeling. And well, I didn't actually put this, but you have always to ask about associated symptoms. It looks like I actually forget to add this point, but you have always to ask about associated symptoms. So you don't rely on dyspareunia itself. You have to ask about associated symptoms like discharge, pain, pruritus, other things. Bleeding also. Okay. So we finished analyzing the chief complaint of the patient, the general analysis of it, and the specific analysis for it. Now we are going to ask to continue our history and to ask about associated symptoms. So you have always to ask about fever and lower abdominal or pelvic pain, because if you miss these, you can miss diagnosing pelvic inflammatory disease or suspecting at least pelvic inflammatory disease, which is if you miss this one, you are not a safe doctor, because this type of infection, the pelvic inflammatory disease, as long as it's or when it's more progressed, it's more hard to treat, and there will be more complication your patient have to deal with. So you have to make sure that you catch this as early as you can. So don't forget to ask about these: fever and low abdominal or pelvic pain. You have also to ask your patient if she has any previous episodes from her complaint. Is it her first time, or is it a recurrent symptom? If she was treated previously, and what was her response to the treatment? Well, you have also to take this section and ask your patient about sexual history. It's very essential. You can't skip this one, but you have to ask sensitively. You have to like say something like, I need to ask you a little bit about your sexual history, or I'm gonna ask you something sensitive about your sexual history. You have to give some brief line before you go straight into this, because it's a private thing. So you start your questions by asking your patient if she is sexually active. If she said yes, you have to ask the number of partners, and whether she has a new partner recently, if she uses condom, if there is a history of STI, and if there is partner symptoms. And here you just don't have or you just can't throw this question on the patient and tell her, does your partner have any symptoms? Because she may be she may يعني, don't understand what do you mean. She may doesn't understand what do you mean. So you have to mention the symptoms you are referring to. Like, you have to be more specific in your question. You have to ask her if her partner is suffering from dysuria, which means a painful urination, or if he is experiencing any type of weird discharge or something. You have to be more specific so you can get the information from the patient, and not just throw some random question on your patient without even making sure if she understands you or not. This part, the sexual history, is very important for STI like chlamydia, gonorrhea, and trichomoniasis. You have to ask your patient about the gynecological history, about the last menstrual period and her cycle regularity, because this will help you guess if there is a pregnancy possibility. And you have also to ask about contraception, like oral contraception or intrauterine device. If you suspected that your patient could be pregnant, you should ask her to do, or you should run a pregnancy test just to make sure, because if your patient is pregnant, you can't give her you can't prescribe her the usual medication that is prescribed for female patients who are not pregnant. Besides, you can't treat your patient as outpatient Yeah, as outpatient, meaning that you give her the bill and she go home and take them at home. You have to admit her to the hospital and give the medication through IV line. Yeah, so obstetric history is pretty much the same. You have to ask her about current pregnancies, just to make sure. They also mentioned previous pregnancies, but it's not really relevant in case of vaginal infection. What you are most interested in is current pregnancies. Because as I said, if she is pregnant, you have to prescribe different medication and you have to admit her to the hospital and run your drugs through IV line. Yeah, I mentioned this point. It's important because treatment change. Like, for example, you can't give oral fluoroconazole. Past medical history, past medical history, you have to ask about diabetes because it predisposes to candidiasis. You have to ask if your patient has any autoimmune disease and she is on any immune suppressant drugs, or if there is recent illness, because if she has an episode of infection recently, she has to take antibiotic, or she may have taken antibiotic. So you have just to make sure about this because it increases risk for candidiasis. In a drug history, you also have to ask about recent antibiotic use because, as we said, it is considered as a risk factor for candidiasis. You have to ask about any steroids or current medication, so you don't add medication that can interfere with each other. This section is about hygiene and lifestyle. Well, it's actually, it tells you about the risk factor that the patient might have. Like if your patient is doing douching, especially if she is doing it multiple times a week, or if she's using synthetic products, this increases risk for bacterial vaginosis. If she's wearing tight clothes, if she is not airing the vulva area, she's always wearing tight clothes, and if she actually she's not drying the area, it will also increase her risk to candidiasis beside wearing tight clothes. So this section, the hygiene and lifestyle, it's not only going to help you to indicate what are the risk factors, but it's going also to give you a basis of providing your patient with the right advice, because you are going to know what are her habits related to the vagina area, and you can advise her based on that. Red flags, you have to ask about them. It's very crucial, actually. You can't miss these, because if you did, you are not a safe doctor. You can miss pelvic inflammatory disease, which is going to make you not a safe doctor, as I said previously. You have to ask about fever and pelvic pain. We mentioned this previously in the section of associated symptom. You have to ask about severe abdominal pain. You have to ask about pregnancy. You have to ask about recurrent or persistent symptoms, because if your patient is having recurrent symptoms, or if her symptoms didn't resolve, this means that either you diagnosed her wrong, or she's not responding to the treatment you prescribed her. So you have to change the treatment. You have also to ask about postcoital bleeding. So any vaginal infection or any vaginal complaint has 5 pillars. You have to ask about these 5 pillars, or cover these 5 pillars in your history. Complaint analysis, including the general analysis using the old CART frame, and the specific analysis, discharge characterization, associated symptoms, sexual history, and risk factors. You have to cover all these five sections in your history. So before doing the OSCE simulation, I'd actually like to show you this. It's a sheet I created. You can use it if you are a student and you are still in training, or you can use it if you are a general practitioner. And sometimes when you are asking your patient, because there's so many patients in the clinic, you can miss some questions due to stress. So you can print this. I don't know, you can take it and print it if you wish, or do something similar. I don't think you can print it. This is on video. How would you print this? But I mean that you can make something similar and print it and keep it in your desk. And whenever any patient comes to your office and she has vagina-related symptoms, you can just run this or go through this sheet, and it's going to make sure that you are not going to miss anything. Starting with the patient ID, name, age, profession, contact number, and then chief complaint, and then general analysis. Using the old card frame, I listed everything. Then the discharge characterization, I listed everything. Then the associated symptoms, I left lines so you can write the associated symptoms and write their analysis beside everyone. And then you have to ask about the presence of previous episodes, treated or not, response or to treatment, helped or not, sexual history. I listed all the things that you have to ask about: gynecological and obstetric history, past medical history and past surgical history, drug history, hygiene and lifestyle, red flags to make sure that you are a safe doctor, summary of the positive finding, your diagnosis and management plan, including drugs and advice. I hope this helped you, or this can be helpful to you in any way. I just summarized everything I explained during this video in this sheet. All right. Now, let's do the OSCE simulation. And I guess we have to be fast so the video doesn't go too long. Yes, starting with a practical case, we have two cases. So a patient presented to your clinic. She is a 26-year-old woman. She comes in with a concern about a vaginal problem. You have to take a detailed history. This is the opening statement from the patient. I've been having some unusual vaginal discharge for the past few days, and it's really bothering me. Yeah, so as I said, if you are in an OSCE setting, or if you are in an OSCE setting, you have to introduce yourself and to ask the patient for her permission, and then to proceed with your history. So after you did this, you introduced yourself and you took permission, you have to start with a general analysis of the complaint using the old card. I asked about the onset. It was 5 days ago. Continuous or intermittent? It was continuous. You can pause the video and read thoroughly, because I have to go through this in a fast manner, so we don't take forever. I asked about the course. Is it getting is it getting worse or not? And she said it's getting worse. And then I asked this question to inquire about what does she mean by saying getting worse. And she said there's more discharge now, and that than when it first started, and it's becoming more uncomfortable down there. As you can tell, I missed actually asking her about about relieving and aggravating factor, and I also missed asking her about the severity. So you make sure that you go in a systemic way so you don't forget anything. Then I moved to ask her about her chief complaint in details, to analyze her chief complaint with details. Her chief complaint is vaginal discharge, so I started asking her about the color. She said it's white, sometimes it's off-white. Is it thick or thin or curdy? I was asking about consistency here. She said it's quite thick, and she described it as clumpy. So we are going toward candidiasis. I get it. I said, I get it. Is there any fishy smell? No fishy smell. Is there anything you have noticed that aggravate or relieve your symptoms? Actually, this question was supposed to be asked in the previous section when we were doing a general analysis about her complaint, but it's fine. I remember to ask her here in this section, so it's fine. She said that it's worse with tight clothes, and when she takes shower, it feels better, because shower can soothe the area, especially if she is using cold water. But then after this soothing effect fades, the itching comes back. Okay, so about associated symptoms, I asked her if there is any itching. She said yes, there is a lot of itching, especially at night. It's really annoying. I asked her if there is redness. She said yes. And if there is any fever, pelvic pain, painful urination, and pain during intercourse. She said no. for all of them. But I have to tell you something. This line here is called symptom stacking. When you stack so many symptoms after each other, and this is wrong. Don't do it in OSCE. You don't ask your patient if she is having or if she is experiencing 4 or 5 things in row, because she's not going to remember each one to answer you about it. She's in the best way going to remember 1 or 2. So you have to ask her it one by one and hear her answer to it one by one. You are going to go like this. Do you have any fever? She's going to say no. Do you have any pelvic pain? She's going to say no. But why I did this or stack everything in one line? I just did this for the presentation purpose, so I don't need to add so many slides to this presentation. But as I said, in OSCE, you have to do them one by one and hear her answer on them one by one. Previous episodes, I asked her if there is a previous episodes. She said yes, she had a previous episode about 1 year ago. I asked her if she was treated. She said yes. She went to the pharmacy and they gave her a cream, and it worked for her. Past medical and the drug history, I asked her if she is having any chronic disease like diabetes. She said no. I asked her if she has taken any drug recently, because I suspected, or not I suspected, but I thought about, or everything was pointing toward candidiasis. You have to make sure that she is not suffering from diabetes and she didn't take recent antibiotics. I asked her about recent antibiotic use, and she said yes. She finished a course of antibiotic about a week ago for throat infection. I asked her if she is on any drug now, and she said no. Sexual history, I said a brief line just to make myself more comfortable proceeding in this topic. I said the following questions are a little bit sensitive. I need to inquire about your sexual history, if that would be fine for you. You have always to say something similar. You don't jump right directly into sexual history without doing this introductory line. How many sexual partners do you have? She said one. How long have you been with him? It's about a year. Do you use condoms at all? She said not really. Are you on any contraception method? And she said that she is on birth control pills. I wrote a note here. The patient didn't mention birth control pills when she was asked about her drug medication. And this is very common actually in history-taking settings. Patients sometimes consider the drugs that they use daily. They just forget that they are drugs and they have to tell you about them because it became a part of their daily lives. So it would be better for you if you mention this in your question. Don't go too general and don't ask her, do you use any drugs? Because she may not remember that she's taking birth controls. You always have to give it as to ask about this specifically, like go like this. Are you using any birth control pills, or are you on any medications related to any chronic disease you might have? This would be better for your patient, and they will remember to tell you about their chronic medications or their daily medications. Gynecological history and obstetric history. I asked about her cycle. She said it's regular. I asked if there's anything else you would like to tell me about your symptom. Well, okay, fine. This line is not very professional, because patients are not going to tell you. Sometimes, or most of the times, if you didn't ask the patient about a specific thing, they will not tell you, because they don't know what you are talking about, or they don't know what you are referring to. They are not sitting in your brain. So you have to clarify always, what do you mean? Sometimes they may have symptoms, but if you didn't ask them about having these symptoms that you didn't mention in your history, they will not remember to tell you from themselves. So you have to be always aware, and always, as I said, try to mention things to your patient and hear their question with yes or no, and don't rely on your patient from their own to tell you if they are experiencing something other than what you asked them about. Be aware to this. Well, I actually remembered apparently, to ask her if she is pregnant or not, and she said that she is not pregnant. My summary was that the patient have, oh, it's actually has, the patient has a white discharge for the last 5 days with itching and redness. The discharge is getting worse, no pain, fever, painful urination, or painful intercourse. The patient does not have any medical condition but have taken an antibiotic recently. Well, I have to remind you that I dropped whole 2 sections in my history. I didn't ask about hygiene and lifestyle, and I also didn't ask about symptoms like fever, lower pelvic abdominal pain, postcoital bleeding. I have to ask about these things because I want to be a safe doctor and I want to exclude the possibility of having pelvic inflammatory disease. So I dropped 2 sections in my history. And I mentioned this in this slide. It says the flaws in my history taking. When I was asking her about the discharge, I forget to ask her about the amount and timing. I also wrote here consistency, but it's written by mistake. I asked about consistency. She said thick, but I forget to ask about the amount and timing. When I asked about dysuria, I didn't actually specify if it's internal or external. I forget to ask her about the presence of pelvic or abdominal pain for safety. And I forget to ask her about hygiene section. I dropped this whole section. I also didn't ask her about the severity of symptoms, especially about itching, because this can be annoying and it can impact her sleep. And when I was asking her about sexual history, I forgot to ask her if her partner is experiencing any symptoms. So for the workup and management, for the investigation, you can do a vaginal swab and you can do the pH. And in cases of candidiasis, because we said that our patient most likely is having or is experiencing candidiasis, it would be normal. And if you did a vaginal swab or if you did the microscopy, under microscopy, you took a sample from the discharge and you add KOH, it would show a budding yeast. The management, we have the first line fluconazole, 150 milligram single dose, or you can give her topical azoles like clotrimazole. If you want to give an advice to your patient, you have to advise her with avoiding tight clothing and keep the area dry, avoid unnecessary antibiotic, and return if there is a recurrent symptoms. These are my markings. As I told you, I missed a few things, but my markings are still high, but I have to focus more, not because I want to score the very full mark in the exam, but because I really want to help my patient and to be more safe to them. Well, I think I spent so many time explaining this. So if you would like me to do another video explaining this part or this case, write to me in the comments below and I will make sure to do you one. I just don't want to do this one so the video turn to be so long. If you want me to do a separated video for this one, or maybe I can add another case, so I'm recording a video for 2 cases, make sure that you write down in the comments. Thank you for your time and I hope you benefited from this lecture, and I see you in my next one.